Hey everyone, we've got another heart today. The heart would have sat roughly in the chest like this, with the anterior surface facing towards the screen, the posterior surface towards the turntable, superior head here, inferior legs here, left over here, right over here. Right off the bat, just externally looking at this heart, it appears that the aorta arises posteriorly to the pulmonary trunk. So we might be dealing with transposition, but we shan't jump the gun, and we will start off as we usually do, which is by finding what appears to be the right atrial appendage externally. Here we find an appendage that is triangular or pyramidal in shape or broad-based, consistent with a morphologic right atrium. So we'll take a look at that. And you can see that this heart has been surgically entered before, as we do find a suture line here in the right atrial appendage. So let's go ahead and open up what we think is the right atrium. We do find that there's pectinate muscles that spill outside the confines of the appendage, consistent with a morphologic right atrium. And then we do find what we think would be the oval fossa, but there is obviously been some surgical intervention done here. And it looks like this, in fact, is a baffle that was likely bringing the superior and inferior caval vein flow across the atrial septum and into the left atrium. But we shall find out more as we go through it, but we do see some baffle material here and a baffle that is traversing the atrial septum. We do find the coronary sinus here. And remember, the coronary sinus is associated with an important structure, which is the triangle of Koch, which is bounded by the coronary sinus, the tendon of Todaro, and the right-sided AV valve. And it is at the apex of this triangle that we would expect to find the atrioventricular node. So in this heart, we would expect the AV node to be approximately here. We do then come across a right atrioventricular valve. This has 3 leaflets, and there are septal connections of this valve consistent with the morphologic tricuspid valve. This ventricle does appear to have coarse trabeculations, and there is a septomarginal trabeculation here with its cranial and caudal limbs, consistent with the morphologic right ventricle. So far we have a right atrium, tricuspid valve, morphologic right ventricle, so we do have concordant atrioventricular connections. Now we get into the right ventricular outflow tract here, and we find a semilunar valve here. It has 3 leaflets and 3 sinuses. It's important to note that the semilunar valve doesn't actually have a round or oval-shaped annulus. The true annulus is actually crown-shaped. And so the round or oval annulus that we do create by echo or imaging is really a man-made construct. And even though it's helpful, it's not a true anatomic feature of the semilunar valve. Nonetheless, when we look at the semilunar valve, we do find coronary arteries arising from within the sinuses, here and here. And we do find that the aorta arises from this outflow. So we do have an aortic valve that arises from the right ventricle, and the aorta which arises from the right ventricle. So while we have concordant atrioventricular connections, we have discordant ventriculo-arterial connections. And here's the ascending aorta, here's the transverse arch, head and neck vessels, and then the descending aorta here. Now if we go to the back of this heart, here we find a smooth-walled atrium. It's a little hard to tell because we do see all this baffle material here. Right, so here is all that baffle material, and here is the pulmonary venous baffle. You can see that the pulmonary veins are now getting baffled over to the right-sided atrium. So here's a pulmonary vein, and here's another pulmonary vein. We'll put our probe down there, and you can see that it does communicate with this here, which is a baffle. So pulmonary venous flow would have gone through this baffle, and then from the areas around it, the flow from the superior and inferior caval veins would have been baffled towards the left atrium. So we do have a heart with transposition which underwent a mustard procedure. Here is the morphologic left atrial appendage. You can see all of the pectinate muscles are confined within the appendage itself. The left-sided AV valve does have 2 leaflets, and there are no septal connections of this AV valve, consistent with a morphologic mitral valve. The ventricle that this valve opens up into does have fine crisscross trabeculations, consistent with a morphologic left ventricle. And then as we get into the outflow tract here, we find another semilunar valve. Once again, it's semilunar, doesn't have a true round or oval annulus. It is a crown-shaped annulus. It has 3 leaflets with 3 sinuses and no coronary arteries arising from it, but instead the left and the right pulmonary arteries arising from it. So transposition. So once again, we have concordant atrioventricular connections, but discordant ventriculo-arterial connections. And you will see that there is fibrous continuity between the pulmonary valve here and the mitral valve here. We also do find a patent arterial duct here, connecting the pulmonary trunk to the aorta. So transposition with a mustard procedure, and going through the mustard once again, this baffle would be redirecting flow from the superior and inferior caval veins across the atrial septum and taking that deoxygenated blood over to the left-sided atrium, so then it could go to the left ventricle and get pumped out to the lungs, to the pulmonary trunk. And then here on the left side, the pulmonary veins being baffled over to the right-sided atrium so that the oxygenated blood can make it to the right atrium, then to the right ventricle, and out the aorta to the head and to the body. So transposition of the great vessels with an arterial duct, status post a mustard procedure.